Good morning and happy Tuesday. My name is Marilyn Warnken and I am a program nurse with Two Rivers Public Health Department. Welcome to the monthly surveillance call. Are you feeling a little worn down and tired like the buildings in this picture? We've been there through a lot the last couple of years, but like the birds in this photo, we need to stay on track and voyage on to a resting ground. At least we can hope. If not, maybe we can get lost in the false scenery, take a deep breath and relax for just a little while. Two Rivers Public Health Department serves almost 100,000 individuals in 7 counties that cover approximately 4,624 square miles. These counties include Buffalo, Dawson, Phelps, Kearney, Harlan, Franklin, and Gosper. What we do here at Two Rivers, right now we are out and about giving flu shots and COVID boosters in our schools, nursing homes, businesses, and community clinics. If you are interested in having a clinic, please give our office a call and we will try to line up one up for you. This is our mission and our vision, our nursing team. Our website has changed. We are now at trphd.ne.gov. And we are Region 7. COVID by the numbers. Total US confirmed cases, 96,443,656. 7-day average per 100,000 people is 88.3. Total US deaths is 1,056,702. Total region 7 confirmed is 3,940,620. We have had 45,952 deaths in our region. Nebraska confirmed, we've had 538,494 deaths, 4,551, and then you see Kansas, Missouri, and Iowa. Up to date, since they have come out with the COVID boosters, the bivalent, 7.6 million eligible people in the United States have gotten a bivalent booster, and this helps restore protection that might have gone down since your last dose. And they also give you extra protection for you and those around you against all lineages of the Omicron. And both Moderna and Pfizer offer bivalent boosters. The updated booster is a bivalent because it targets 2 Omicron subvariants, BA4 and BA5. And then flu season is approaching, so the CDC recommends getting both a COVID vaccine and a flu shot at the same visit. So if you haven't gotten yours, get out there and get it. This is from the dashboard on our website. District daily case rate per 100,000 is 12.5. We have cumulative deaths of October 2nd is 224. This is our hospital data. Top left, ICU beds are increasingly available. The most recent number shows 50% of beds are available. Middle top, ICU staffing has remained consistent for quite a while, and we generally have 32 beds staffed at any given time. Top right, the number of beds occupied by COVID patients has stayed below 10% since August 8th. This is interesting because last year at this time, the number of inpatients positive for COVID was steadily increasing until the district hit a peak number of COVID patients on December 1st. Bottom right in the green, we do not appear to be increasing at this time. Nebraska is currently changing systems in which hospitals are required to report staffing and capacity numbers. Hospitals are still required to report numbers, but as a state, we are moving to a Javari system. And we'll go from there. Monkeypox update. Two Rivers Department is tracking monkeypox outbreak with Nebraska DHHS and the CDC. Two Rivers sends out a weekly monkeypox newsletter, which this is the copy of. Numbers continue to rise with 26,049 confirmed cases as of October 6th of this year. In Nebraska, 29 of those have been in Nebraska. And the US has had two total deaths. CDC is recommending vaccination against monkeypox using the following strategy: the post-exposure prophylaxis, the expanded post-exposure prophylaxis, and then pre-exposure prophylaxis. Also, the CDC has come out with a health alert network just to let us know another confirmed case of Ebola. A 25-year-old man who lived in Mubindi district quickly identified it as a suspected case of viral hemorrhagic fever and isolated in the regional hospital there. Blood collected from this patient tested positive for Sudan virus by real time. The patient died the same day, had a supervised burial, was performed by trained staff wearing proper personal protective equipment. Further investigation into this case revealed a cluster of unexplained deaths occurring in the community during the previous month. As of, sorry about that. As of October 6th, a total of 44 confirmed cases, 10 of those confirmed cases and 20 probable deaths of Ebola have been identified in Uganda. This is the 5th outbreak of Sudan virus in Uganda since 2000. Current outbreak is in the same area during 2012, limited secondary transmission was reported and the outbreak was effectively contained. As of October 6th, no suspected, probable, or confirmed Ebola cases related to this outbreak have been reported in the United States or other countries outside of Uganda. Okay, flu. It looks like our Texas, Georgia, and District of Columbia, and then the North Mariana Islands have high levels of influenza. Everybody else is moderate to, or even low to minimal. This is a chart that shows, compares last year to this year. And this is, over here is last year, like at week 40, is right in here, and we're at week 138 right here. So we'll be possibly start to see an increase in the flu in the next 6 to 8 weeks if history repeats itself. Also with the flu, we have outbreaks that looks like there have been 13 positive influenza A cases, 5 positive B, and then total this season so far, 1,114. RSV is what we're seeing the most of right now. We've had 256 positive cases as of week 38, which just ended. Another mental health for your information. This is not public information yet, but a Kearney physician has not had their medical license renewed and is no longer able to prescribe medications as of 10/7, which was last week. And they have a lot of people on medications that are going to be running out. So their patients are being encouraged to find another provider as soon as possible. Many of the scripts are addictive and can cause problems, especially if there's a lapse in the dose schedule. Listed on this form are signs of overdose basics. In the event of an emergency, call 911. If you have any questions about this notice or need additional resources, please call our office at 888-669-7154 or Region 3 Behavioral Health Services. We still have free dental screenings going on for ages 0 to 4. These clinics are held from 9 to 12. We have one here in the Kearney office on October 26th. And we have one in the Lexington Community Action Partnership on November 4th. To learn more about Life Smiles, please contact Two Rivers Life Smiles team via email, lifesmiles@trphd.org, or call 888-669-7154.
In Maryland, this is Jeremy. So I just want to say hi really quick to everybody, all of our partners. So today we're actually, our dental program is really the unsung program right now in a lot of ways. We've been really busy the last year and a half, and just been in a lot of different places actually. So today we're out in the Bertrand and Loomis area. This is a program that's entirely based on donations, and we do a little bit of billing to the Managed Medicaid MCNA, but it by far doesn't cover all of our costs. So we're always looking for opportunities to raise funds, whether it's through PTOs, community foundations, things like that for this program. But this is just a group of, internal employees and also contracted dental hygienists that comprise our team. But they're out really busy, and they're kind of on the downhill slope right now, where we're trying to get out to schools, within about that first month and a half or so. And some of our high need schools, we try to get out 3 times a year, but really an evidence-based practice that prevents dental decay, providing both sealants on teeth, but also just trying to teach healthy behaviors, using fluoride and toothpaste, things like that. So, but thank you, Marilyn.
You're welcome. Thank you. And then we have our testing going on here at the office on Mondays and Wednesdays from 9:30 to 10:30. All those wanting to be tested must register at Two Rivers trphd.ne.gov, and you need to register before you come to the clinic so that you have a number when you get here. Please stay in your car, give our office a call, and we will come out to the car and do your testing for you. Also, this is our clinic schedule. We do adult and childhood immunizations. That includes the flu shots and all the COVID boosters here in our office. Usually rotating on a schedule between Mondays and Thursdays. And you can take a look at that. And then it's harvest time. It's dark longer in the morning, getting dark earlier in the evenings. We all need to slow down and be patient with each other. Slow down in intersections, stop at all stop signs, and proceed with caution when passing oversized, slow-moving farm equipment. Watch for turning trucks. They need more room to turn. Just slow down, save lives, be safe. And that's it for today. Thank you for your time. Hopefully we shared some good information with you. Stay safe, stay healthy, and have a great rest of your week.